Muscle spasms are an unexpected visitor that can turn a day or night upside down. From minor annoyances to major problems, muscle spasms can strike at any moment. If you have recurring muscle spasms, physical therapy can be a great option in helping you manage those symptoms. This video is going to dive in to what muscle spasms are, how they affect you, and how physical therapy can help. Hi, my name is Chris Brandt, and I'm a physical therapist at EW Motion Therapy in Birmingham, Alabama. I see muscle spasms all the time. I have a lot of patients that deal with them on a daily basis. Before we dive into the details, I really want you to understand what muscle spasms are. So a muscle spasm is an involuntary contraction of a muscle where it becomes very difficult to relax that muscle. In some cases, it can stay contracted for a long period of time, and in other cases, the muscle spasm will happen and then release on its own. Muscle spasms can affect any muscle in the body, but they primarily affect hands, feet, calves, and lower back. Let's review 6 of the most common causes of muscle spasms. Number 1, dehydration. Drinking water throughout the day is essential in keeping your muscles nice and fluid and not allowing them to get too tight. Number 2 is overexertion. This has a component that is dehydration because as you overexert, you're going to lose water content through sweat and other means. But this also has to do with increased cardio output while you're doing that, increased heart rate, increased breathing patterns, which can contribute to muscle spasms as well. Number 3 is going to be mineral imbalances. As you sweat or as you excrete fluids, we typically have different changes in our sodium levels, our magnesium levels, copper levels, and several other factors that can also really affect how your muscles contract. Number 4 is going to be nerve compression. In tight muscles, you can have some tension put on nerves, which may give your muscles too much input, which can cause muscle spasms. Number 5 is medical conditions. The most common are typically neurological disorders, such as Parkinson's, or ALS, MS, or any type of spinal cord injury or issue. Number 6 is medications. Anything that has diuretic properties or any statins. Those 2 medications seem to be the most popular, but there are several other medications that can cause muscle spasms as well. Physical therapy can be a crucial part of managing chronic or even acutely recurring muscle spasms. Number 1 is going to be assessment. A physical therapist is going to look at your range of motion, is going to look at your muscle tone, is going to look at your mobility, and be able to determine whether you might be having compensations, whether from posture or mobility or any other sort of mechanical issue that could be overloading those muscle groups that you are getting muscle spasms from. Number 2 is going to be using that assessment to develop customized exercises, whether it's stretching or strengthening, or just getting you in a good routine so that you can feel more confident and align yourself better to decrease the muscle spasms that you might be having. Number 3 is going to be education. Sometimes a physical therapist may find that your range of motion and mobility is fine, and therefore we might have to discuss some things about your diet or lifestyle or the way you sit at your desk during the day. Number 4 is going to be manual therapy. Physical therapists are typically very good with hands-on manipulation. It can sometimes start out as massage and turn into something deeper where we can actually use our hands to decrease muscle tone and increase blood flow specifically to the areas that are being affected by muscle spasms. Number 5 is going to be electric therapy. And in that case, we use a modality known as E-stim, where we place these sticky electrical pads in the areas that you're having problems with. And there are certain levels of electric stimulation that can allow decreased tone in that muscle, increased blood flow, and then we can combine that with heat to really give that muscle a lot of input so it will decrease that output, which causes muscle spasms. Muscle spasms can be big inconvenience and very painful at times. But if you take some proactive steps by understanding what a muscle spasm is, what the causes are, what the risk factors are, hopefully you'll be able to decrease the impact of them on your life. Another useful tool that physical therapists use is called dry needling. Many people have found great success by using dry needling to decrease muscle spasm and muscle pain. Click the link in our description below to watch our video, Dry Needling for Muscle Spasm Pain. This video will give you details on what dry needling is and how it can help with muscle spasms.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.